Inflammation is the response to injury. Whenever there is injury, body responds by inflammation. When there is inflammation, a lot of chemicals are released. Most of these chemicals are proteins. These proteins are specific for inflammation, but they're not specific for the disease which is causing inflammation. So they may be sensitive in picking up that disease is going on, but they do not specifically tell us what disease is going on. So they can be used for example, diagnosing and assessing the presence and severity of inflammation, guiding the treatment decisions, and then another important role they can play is monitoring response to treatment, whether the treatment is effective or not. Inflammatory markers, if they are increasing, treatment is not working. If they are resolving, that means treatment is working and the patient is getting better. Now, what are different type of inflammatory markers? Some of them are very commonly used. For example, C-reactive protein, which is synthesized in the liver. The beauty of C-reactive protein is its level, they vary with inflammation, that it follows very nicely the inflammation. As the inflammation increases, it increases. As the inflammation decreases, it decreases. The other marker is ESR. ESR is a very good test, but it's slightly slow to respond to inflammation, so it lags behind a little bit. And another disadvantage of ESR is that it may be raised in other conditions other than non-inflammatory conditions. For example, it may be elevated in anemia or pregnancy, or in multiple myeloma where a large amount of proteins are formed which can cause a rise in ESR. But otherwise, it's a very useful test for testing inflammation. And then we got procalcitonin, which is a precursor of calcitonin. This is raised in bacterial infections. So whenever there is sepsis and you're not able to decide that this is a viral infection or bacterial infection, procalcitonin may be very helpful. For example, in the epidemic of COVID, we see it's a viral infection, but if the symptoms are not improving, patient is getting worse, there is pneumonia because of COVID, to see if this is superimposed by bacterial infection or not, the procalcitonin is very useful in investigation, and it was very frequently used. And then there are other markers of inflammation which are present, but they're generally not tested. They're tested in special circumstances. For example, amyloid A protein or cytokines like interleukin 6, interleukin 1, tumor necrosis factor alpha, ferritin, alpha 1 acid glycoprotein, plasma viscosity, which is not actually a protein, but it's the way the plasma becomes thick. When there are a large number of proteins, the plasma becomes thick. So the plasma viscosity may increase in inflammation. Then ceruloplasmin, a copper carrier protein, rises during inflammation. Similarly, hepcidin is an iron regulating protein that rises in inflammation. This haptoglobin is a free hemoglobin scavenger in the blood. Free hemoglobin in the blood is taken up by the haptoglobin. It also rises in inflammation. And then finally, platelets, they also increase in inflammation, particularly they are acute phase reactants. So these are different inflammatory markers which are commonly used. Three of them are regularly used, like CRP, ESR, and procalcitonin. Others are used less frequently, and they just indicate the presence of inflammation. They actually do not tell us what is the actual underlying disease